They want me to bend over. We are now going to play the service song medley. So if you're able, when you hear your service song, please stand up. And if you're unable to stand up, give us a wave so we can recognize you. We appreciate you and thank you for your service. We're going to start out with Coast Guard.
Coast Guard.
1, 2, 2, 3.
Thank you. God bless you.
Hello. Good afternoon. Welcome to the Orlando VA Town Hall. If y'all can take your seats, we'll get started in just about 2 minutes. So thank you. All right. Well, good afternoon, everybody. Welcome to the Veterans Town Hall meeting hosted by the Orlando VA Healthcare System. Thank you for joining us today, and thank you for your service to our country. So my name is Kendra Negron. I'm the Acting Chief of Veteran Experience Office here at the Orlando VA. And before we begin, I'd like to lead us in the Pledge of Allegiance. So if you'll please stand with me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You can have your seat. Well, today's event is intended to be a listening opportunity for veterans. The goal is to ensure that veterans, their families, and others are provided with updates and other important information. There's a lot of information that will be shared today. We'll provide additional time for questions to be answered at the end of the panelists' remarks. If we do not get the opportunity to respond directly to your question today, you may email your question to vhaorladvocates@va.gov, or you may speak privately with one of our advocates here in this room after today's event. And the unanswered index card questions will be followed up in the coming days. Before I go any further, I'd like to go over some important information and ground rules. So 1, please know that this is a public event that is being recorded and shared online. 2, we ask that you please be cordial and direct when asking questions and allow time for our panelists to provide a full response. This will help ensure that we fully answer questions, respond to concerns, or address constructive recommendations. Also, if you're joining us online, please clearly type your question or comment in the comment section on our YouTube live post. Please be respectful of our panelists, veterans, their families, and others who are here with us tonight and who are virtually tuned in via YouTube Live. This event is intended to foster positive communication and dialogue. Disrespect of our panelists, veterans, and their loved ones and others will not be tolerated. So now, please let me introduce the leaders joining us today. So first off, we have Mr. Timothy J. Cook, Director and CEO of the Orlando VA Healthcare System. To his left, or to your guys' right, is Mr. Charles Ellis, Veterans Service Center Manager, St. Petersburg VA Regional Office. Thank you for being here. And lastly, we have Miss Cindy Van Bibber, Director for the Cape Canaveral National Cemetery. Thank you for being here. All right. I'd now like to welcome Mr. Cook to provide some remarks.
Let's see. Make sure that everything is working fine. Can everybody hear me okay? As they say, 5 by 5, right? All right. Okay. Well, thank you all so much for coming. This is an incredibly unique opportunity to have an open dialogue with our entire veteran audience, along with our staff, and even to our good friends that are joining us through our YouTube channel. So this event is also meant to be an information gathering session. So I would like to ask, before we start, how many of you have had a chance to at least do one full loop around the auditorium here, the open area? Yeah? So have you found it useful thus far? You know, I've talked also with the team that has been part of this presentation, and they are super thrilled with the questions that you're asking. They are so excited to hear the positive connections that many of you have already made. Some of you are return visitors, have already been here through when we had our 250th birthday anniversary event, and you got some really great information there. And therefore, now we are continuing that journey, and we will always continue that journey. Today with us, I know we have several of our patient advocates. Where are our patient advocates here today? Can we, and our subject matter expert staff, can you all raise your hands just so you know we know you're, I see you out there. Even our chaplains, raise your hand, come on. Let's give a round of applause for our subject matter experts. So one or two things as we begin. The Orlando VA continues to grow, and that growth means that we have to find a way to keep up and, in fact, get in front of that. You can see that we've got construction going on here. You know that we also have construction going on at some of our other sites. You may see that we're going to be expanding our emergency room by an additional 12 beds. Oh, sorry, 14. Thank you. We have an incredible team down front feeding me information just in case I mess anything up. So adding those beds, plus I think there's also going to be 4 observation beds that will help 6. If I wait another 5 minutes, we'll have 10. I think they'll take over the entire building. So I just keep moving. You'd be really interested to know also that we just exceeded 150,000 veterans that are enrolled here at the Orlando VA. You know, that's really nice, but the thing that I found most staggering, that there are still 50,000 eligible veterans in our community right now that have not chosen to use the VA for their care. 50,000. That's amazing how much more that we could bring in and be available for our teams. And when you say, well, how is it possible that if you're having maybe some struggles keeping up with what you're doing right now, right? These are questions that you have all asked in advance. What does that mean? So we have some of our team here from Community Care that will be helping us answer some of those questions. But just so you know, we are still very committed to providing all of that care to you ourselves. And in combination with our Community Care team, we're doing exceptionally well. Now, that being said, we do have areas that we always want to strive to improve. But if you turn around just for a second, and maybe the cameras can't catch this, but if you see on that wall right there behind you, it says 5 stars. Now, what that 5-star means is that we have been rated by Centers for Medicare and Medicaid Services as a 5-star out of 5 now in quality of healthcare. We are the only healthcare system in all of Central Florida to be rated a 5-star. That's all facilities, all. And that is 3 years running. So 3 years consecutively now of exceptional quality care for our veterans. But we're not done there, right? 5 stars is just a symbol of all of the care that we put together and the responsiveness of our team to be there for you when you need us. So we need to continue our conversation. Each and every day, we're going to continue that conversation. You can see the partnerships, and I see Tony Ellsworth right down front here. Tony has been an incredible partner to make sure that we are including our community in the advancement of our long-term care and the needs of our veterans as they age. Wonderful, wonderful program. We just cannot thank you enough for being the exceptional partners that you are. I'll stop in 1 second, but I do want to say how really vital it is to have both the VBA and the NCA here today with us on this panel to be part of a continued conversation on every bit of what we do. That is from the day that you leave your active duty service and the benefits that are due to you, and the wonderful team that was here today providing answers to benefits questions. And I don't know if you knew that, but they were down there knocking them out. So thank you very much for being here, for being part of that. And Cindy, thank you also. I get a special place in my heart for the National Cemetery. I have several members of my family that are buried in the national cemeteries across this country. And so I make it a very important journey every time I'm near the coast to drop in and see the beautiful facility and just how incredibly manicured everything and the love and compassion that is put into it by your staff. So I just wanted to express the appreciation for you all for being part of this incredible team here in Central Florida. Well, without further ado, Kendra had to sit down. I was going on too long. So I want to be sure that we get to many of your questions. And several of you, I think, have asked questions in advance. And I think we also took some of your index cards. Did you all get some index cards that might have been able to read? You can see hold them up high. You can see them. If you all still have questions, please go ahead and shout it out, raise your hand, and they'll come over there and drop off a card for you so that you can write down your question. Kendra, back to you.
Thank you very much. Would our other panelists, would you like to introduce yourself and say anything, Ms.
Well, like you said, I am Cindy Van Bibber. I am the director at the Cape Canaveral National Cemetery. I've had the privilege of working for the National Cemetery Administration for 20 years. And 10 years prior to that, I was working at a state veteran cemetery up in Virginia. So after 30 years of service to the veterans, I am an Army veteran myself, of course, the best branch of service. So I am glad to be here, and I'll look forward to helping you understand what your final benefit will be and making sure that you're prepared for it. There's nothing like making sure that your family is aware of your benefits ahead of time, and so that you know exactly what they are. So thank you.
All right, can everybody hear me okay? All right, good afternoon. It's a pleasure to be here. Thank you for inviting VBA to join this event. I hope you guys did get a chance to see some of our representatives. We have down the hall, straight down to the left. We have 3 representatives from VBA here that can answer your questions, because many of your questions will require someone to actually pull up your record, see what's actually going on, rather than just give an off-the-cuff answer. But those guys are really good, and girl, lady, So I don't have a team of people like you do up here. So if you stump the chump, you might get me on that. But yes, we got plenty of help here, and they'll be here till 4 o'clock at least. So if you need a claim-specific answer, those are the folks to go to. But I'm going to just introduce myself. Charles Ellis. I'm the Veterans Service Center Manager at St. Petersburg Regional Office. I've been with VA for 25 years. Prior to that, I was the best service, Army veteran. Florida is a very unique state. I've been down here since 2004, and I love the St. Petersburg Regional Office. It's not Orlando, but it's a great place to be. I know Orlando's got a huge veteran population, so we're always up here, and I'll talk a little more about that. The VA itself is really changed quite a bit, and VBA is no different to that. With Florida veterans, Florida has the second highest veteran population in the country. I think it's 2.1 million. 1.2 million veterans in Florida. And the St. Petersburg Regional Office helps support the claims processing for veterans that live in Florida and throughout the country, as the VA has gone to a national work queue model where we also work claims outside of our country depending on capacity. We are the biggest office, the biggest regional office in the country. We are not just claims processing, though. That is our big portion of what we do, disability compensation claims, but we also have a Decision Review Operations Center, a DROC. There's 1 of 3 in the country. 1 of 3 in the country, and that's the biggest one is in St. Pete. And we also have a Vocational Readiness and Employment Division, the biggest and most productive in the country. So they do a great job. So altogether, we have about 1,600 employees there supporting veterans throughout the state. I want to talk about the disability backlog because that gets a lot of attention. I know the Secretary has mentioned it many times as one of his top goals to work on getting the backlog down. VA has processed claims faster than ever before in the last couple of years. And June 1st, VA passed 2 million claims processed for the year. We are on track to complete more than 3 million claims, which would be a record from breaking last year's record. The backlog is down to a little over 70,000 claims. 72,000 was my latest numbers. And the average claims process is about 71 days. Quality remains high and steady despite increased production at 94% nationally and 96% locally. I talked a little bit about the DROC, but I'll mention, because I know appeals are a big topic, and even though I don't work in the appeals division, we work right side by side with each other. The Appeals Modernization Act has been a game changer to help streamline appeals processing by allowing veterans to have more choice on how they process their appeal. So now if you disagree with your decision, you can file a supplemental claim, submit new evidence, and we can make a new decision. Or you can submit a higher level review, which goes to a higher level claims processor, decision review officer, and they'll take another look at it. It's basically like getting a second opinion, and they can make a different decision than the previous claims processor made. That's the quickest way. And those claims are running about 70 days decisions for the higher level reviews. Or you can go straight to the Board of Veterans Appeals, which has always been an option. So those have been the 3 options that the Appeals Modernization Act has helped kind of usher in, and we've seen a lot of success there. I'll talk a little bit about VRNE, our Vocational Readiness and Employment Program, because it's kind of the crown jewel of VBA, I think. Our VRNE division has helped over 16,000 veterans this year pursue employment, independent living. This year, over 1,000 veterans completed their programs, 2,900 rehabilitation plans were developed, and 1,300 veterans finished training and are actively seeking employment. Nearly all claims received in October since 2025 are actively assigned to a counselor and working for employment. As far as pension and survivor benefits go, we've made tremendous strides in the processing times of those. Veterans' pension claims are now averaging 57 days, which is down from 170. Survivors' pension claims are 73 days, down from 172. Dependency and indemnity compensation claims, the death claims, are processed are down to 73 days processing, and the backlog's been reduced by 83%. Before we open it up for questions and move on to town hall, I just want to make sure you guys know how to contact VBA. There's many different ways. I work at St. Petersburg Regional Office. That might be far from you guys, but we also have an office here at Lake Baldwin, the VA clinic, and they're there Monday through Friday, 8:30 to 4. You don't need an appointment. You can just walk in and get help your claim, file your VRNE claim, whatever you want to do, ask questions, speak with a counselor one-on-one. We also have VA call center, which you may be familiar with. It's 1-800-827-1000. You can ask a question online through Ask VA, and you can log into your account and ask a secure question. You can ask a claim-specific question and get a response back from a VA employee. We also, something I'm proud of is we have in-person or virtual appointments. It's using our Vera system. And that allows you to schedule an appointment on your time when you want to speak to a VA representative. And so you can go in the portal, pick your office, select a time, and you can do that virtually or in person. And that way you don't have to sit around waiting, because you show up at the regional office or the Lake Baldwin. Our average wait time is not too bad. It's about 20 minutes. But this way you get, if you want to call right away or something, you can get a call at a certain time. And then our vocational rehabilitation employment, if you want to speak to them, they can be reached at 727-319-7902. So that's all I have, and I'm anxious to hear your questions. I know I spoke to many of you before the event and got a chance to hear some of your stories, so I'm glad you're here today. Thank you.
All right, thank you very much. So we might have a little bit more information shared. Would you like to share, Miss Cindy, a little bit more?
Thank you. I just want to make sure that you all know that there are 9 national cemeteries here in Florida. If you're eligible for one, you're eligible for any, and that means from coast to coast, not just the 9 here. So 157 national cemeteries across the country. There's 2 in Puerto Rico, so up in Alaska, out in Hawaii. So it's your choice where you want to be placed for your final resting. That is your decision. That's your family's decision. I also just wanted to make sure that people knew that definitely the veterans, taking care of veterans is our motto for the National Cemetery Administration. We might be the smallest entity of the VA, but we're the mightiest. We're mostly veterans that taking care of veterans, and we're proud to be there. Especially, I know everybody says we're the Cape Canaveral National Cemetery. We're not out on the Cape. We're on Highway 1 in Mims, as far north, almost as far north on Highway 1 as you can get in Brevard County. The National Cemetery Administration is also proud with the fact that when we send out customer surveys every single year to the families that we serve, and the National Cemetery Administration has received a 98% score on that, which is the highest of any public or private entity that has ever been scored. So we're proud to say that we are here to take care of the families and the veterans that we serve. I just want to say that again and make sure that you all know, if you get the opportunity, make sure you know what your benefits are now when it comes to the National Cemetery, because there's a lot of misconceptions about what is available and what you take care of and what the government take care of. So, of course, again, it's your benefit, but the benefit is at the cemetery. A lot of people are led to believe that everything is covered and you still have to take care of your own funeral home expenses. I have a lot of information over here on the table, some brochures. I encourage you, like I did myself, so I'm not telling you to do something I didn't do myself, but predetermination of eligibility. Okay, predetermination of eligibility is going to make sure you're 100% sure that you're eligible. You get to pick the national cemetery that you are most hopeful to get to. I'm personally going to tell you, I'm a Husker, so I'm going to, and I did, put my predetermination of eligibility for the cemetery out in Omaha, Nebraska. Okay, what that gets you right now is, if you do it ahead of time, is access to an online portal where you can go in and share your stories now. Because when you pass away, it's going to be a little too late. Okay, put your stories, your pictures, do everything you want to do to tell your story now, and that portal doesn't go public until after you pass away. So then after it goes public, then your family now has access to this portal. They can go in there. They get to see all the information you've put in there if you bother to go ahead and make the predetermination eligibility something that you did. Because after we pass, it's going to go public, and now your family and your friends can go there. But I think it's just a really great opportunity for families to be able to track that. It's a legacy program. Veterans Legacy Memorial. So I'm going to give you an example of why I think it's really important. I had a friend I served with, and she passed away in early 50s. Her grandchildren are never going to know the story that grandma wore combat boots. Okay? I get to go on Marge's portal, share the pictures, and tell the story of when we served together. So her grandkids now have a way to go in there and see the story about their grandmother. So please take the opportunity to get your eligibility determined in advance. Register, if you will, that's a way to say it, so that you can make sure that you have the access to that portal. And again, if you have any questions, obviously that's why we're here, but if you don't want to ask them in this environment, you can step over to the table afterwards and I'll be glad to assist you. Thank you again.
Thank you, Cindy.
Mr. Cook?
But wait, there's more. So one of the things that I love seeing are some of our initiatives that we started a few years ago starting to come to fruition. And one of the most important expansions that we've been working on is urgent care. So our urgent care, in addition to our emergency room, which is here at the Lake Nona campus, we now have urgent care at the Lake Baldwin campus, the Viera campus, and the Daytona Beach campus. Currently, the Lake Baldwin campus the hours of operation are 7 a.m. to 7 p.m. And the other two right now, Viera and Daytona Beach, are 8 to 4:30 right now. But the goal is to continue that expansion. So the next piece that I wanted to mention was, in part of our long-term care strategy has been to expand home-based primary care. We are now have roughly 820 veterans every single day that are aging well at home. So if you're not familiar with the home-based primary care program, I urge you to talk a little bit more about that. We are working our way towards 1,000. So by the end of 2027, hopefully by the middle of 2027, we will have made it to 1,000. And that just means that we have more services, more access to those long-term benefits to our veterans over the next year. So those are very exciting items. The other thing I wanted to talk about, Dr. Boyer is like, yay, goodness, good. And she can give me some more information. I'm sure I'm going to miss something. The one of the most impressive expansions that we've been undertaking is on our Space Coast, so along the Atlantic, in Viera. Right now, we are working with Patrick Space Force Base, and hopefully we've signed a memorandum of understanding with Patrick to allow us to use 2, I think, starting off, maybe 3, of their dental clinic chairs there for veteran patients. We are not ready to start that just yet, but I see Dr. Faruqi in the crowd. Dr. Faruqi, please raise your hand. So if anybody has any questions about dental services, you can see Dr. Faruqi. And if you have dental questions where maybe those services are being conducted in the community, you can also talk to Dr. Fair. And Dr. Barbara Fair is right here. Dr. Barbara Fair, please raise your hand. I'm pre-staging some questions for you. Also, very, very proud to say that our surgical program here, and I see Dr. Ben Allmiller over there, Dr. M. Allmiller, our acting chief of surgery. Please raise your hand. Say hi to everybody. The Orlando VA is now the #1 robotic surgery in the entire United States of America. #1 in the country. We have 3 Da Vinci robots, if I'm not mistaken, 1 Mako robot, and 1 more. That's it for now. Today. Maybe tomorrow we'll have another robot. They just multiply these robots. The last piece that I'm also very proud to say is that, and you may have heard that oftentimes that the government has not had the money to pay for more staffing. The Orlando VA has not been subject to that. We have continued to hire for the last several years, and I'm very proud to say that we are continuing to hire. We bring on average every 2 weeks in our new employee orientation an additional 35 new staff to this medical center every single 2 weeks. And our goal is to improve that to 50 every 2 weeks. So 100 new staff per month is now our major goal. And those goals are to be sure that we have enough psychiatrists, psychologists, dental hygienists and technicians, our housekeepers. I'm getting to nursing. Don't worry. I'm getting to nursing. Nursing, as we know, is like the circulatory system for our entire operation. If nurses don't flow, we die. So therefore, an imperative has always been, and again, the end of this year, we'll probably have 100 more nurses on at the end of this year than we started the year with. So again, those are statistics that maybe not everybody is looking around going, what does that really mean? Well, for a staff of about 6,000 in the Orlando VA healthcare system, having new people come into the system so that we can provide those services is vital, including our chaplains. No, this is a very true statement. We are very blessed, and I will use that term directly, very blessed to have now, I think, on staff, 14 chaplains. 14. The spiritual health, in addition to the emotional, the mental health, and the physical health, have been part of our strategy to help our veterans with every one of their needs. And it's not just about being there at end of life. They are also embedded now in our domiciliary, which is our residential rehabilitation program. They are regular visitors and participants in home-based primary care now. We see them and welcome them into every single corner of our care. So, I could go on, but there are questions to be asked that Kendra is now prepared to launch.
Yes.
Kendra?
Thank you guys very much
Back
for
to you.
sharing with us. All right, so now we'll start the question and answer portion of our Veterans Town Hall. If you have a question, please raise your hand and one of our helpers will be right over to assist you with a microphone. If you're joining us online, we ask you submit your questions in the comments section of our YouTube live post. And we ask that whatever questions that do not get answered here today, you can email them to vhaorladvocates@va.gov. Or if you filled out an index card, we will be reaching out to you in the next few days. We'll also probably do some of the index cards in amongst the questions from the audience. All right, so any questions? Now is your time to raise your hand.
Do you have any questions to start? Oh, yeah, go right ahead. There's a question right here.
All right, right up here in the second row.
Somebody had to go first. All right, the question I have is the MOVE program in the BAM, which is the weight loss program. Currently, the second class we do that's smaller is inside of the classroom. Do you have an idea if we may have a bigger space for that, or something where you can offer more classes, whether it be Tai Chi, other kinds of movement classes for veterans?
You know, that's a wonderful question. I think so. This is not a joke, and I don't mean to say it this way, but the smaller people get, the less room you need in a conference room. So it's one of the benefits of the MOVE program is we don't hopefully need a bigger space, but I'm being a little silly. The best part of the MOVE program is I've seen it. I have used the MOVE program philosophy myself now for the last year, and I'm very proud to say that I've lost 35 pounds. And being able to witness what that has meant, not just to my life, but my family's life, I think what you're describing is something that everybody should hear more about. And it is something that every one of us should take our own personal responsibility for our health, right? And get involved. The MOVE program, and I think if I have some of my colleagues in the crowd, if anybody's here and wants to talk about how we tie the Tai Chi, and I think Qigong, I believe also is one of our specialists that we have to that MOVE program. I want to be sure that I answer your question, but I know there's somebody here that has, and I see Mary Lou coming into view. Mary Lou, the MOVE program and the expansion of the MOVE program and how it works also with getting Tai Chi involved and other specialties.
Well, keep in mind, it's weight loss and there's some exercise programs that go along with that, but Tai Chi and some of those programs are also part of whole health as well. So, we're able to, as we have people that can do that instruction or able to set that up, we have those opportunities to expand those programs. I thought I heard space or something like that. A lot of things do very well on your BBC too. So we are doing a lot of programs with our instructor, maybe here, maybe in a room by themselves, so people can go ahead and do it on video, so they can keep it home in their own comfortable place.
By the way, this is Mary Lou Williams. She's our Chief of Nutrition and Food Service, so she knows everything there is to know about that MOVE program. How would you say, Mary Lou, if people have more questions about how to get connected with the other programs, would it be to talk with their primary care physicians?
Starting on your primary care team, they can connect to what every PAC team does have a dietitian assigned to them, and then can have a conversation with them, and then also again your whole health coach has that knowledge as well, and get you into all the programs that are for you, not for prevention, right? So MOVE, nutrition, preventing illness, or getting you better, right? Whole health, the exercise programs that go with that can do the same thing. We have a lot of programs like that. We're not just here because you're sick, we're here to keep you better.
Excellent. So, but to answer your question, if we start getting to capacity in a specific space and we need more space for the MOVE program, we'll find another room directly adjacent to it. There are a number of places up there that we could expand to if necessary. So we would absolutely love to do that. It's very tight. It's very, very tight. Is your name Edward? Ah, I got your question right here. You're right on top. How that's like magic. But yeah, I think one of the other things that we probably need to work on in our long-term plan, our more strategic, is to actually create and build our own fitness center and have something on site that would be part of that. So I see a lot of advocates for that. We can write that down. I think I see some of my friends that are already taking copious notes. All right.
All right. Oh, looks like we got another question coming up.
Time, she's going to need skilled nursing facilities. My wife and I, although we're trying to take care of ourselves, we might go on forever. And she needs to have a skilled nursing facility, because we have no other family down here in Florida, and very limited where we come from back east. So, at any rate, I already inquired at the facility in St. Augustine, Lady Maine is the administrator there, and spoke with her. Forward all the paperwork up there for her. And that they have 6 beds that are up there for female patients, because there's certain criteria that has to be made for a female patient, obviously, that can't be placed in a large room. And so at any rate, everything is full. They don't know when everything's going to open up. And they inquired after it was on the beach, at the facility down there. They have 6 beds allocated, and only 3 are available, not right now, but the other 3 are occupied male veterans, because they have a situation of overcrowded and that they need to be beds. So basically, question is the VA has any plans in the future of building another facility, perhaps more female veterans? Because it's my understanding there's a lot more veterans females today than there has been in 20, 25, 30 years ago.
Yes, sir. Actually, I'm glad you asked that question. And so just for clarification, you're referring to the State Veterans Home in St. Augustine and also so the skilled nursing? Okay. So yes, in fact, we do have in our multi-year plan for long-term care in both Daytona Beach and in Vieira. So right now, it's not funded. It's not something that is imminent to be built. But yes, we do have plans for the future. But I would say, though, there are incredible state veterans nursing homes. And the one in Daytona Beach in particular, I think, is also an excellent location. Not far from the federal VA, but it is a state-run Department of Florida, the state of Florida Department of Veterans Affairs runs that campus. However, you mentioned that your daughter was 80% service connected. Is that correct? I think there are also eligibility opportunities for veterans that are 70% or more service connected to be also eligible for care at VA Medical Center, community living centers. That would be also another opportunity. And as I mentioned, I do think that there are caregiver questions, like the caregiver support program is also out there, and home-based primary care is also a benefit that we might be able to work with you and help you with. And I know some of our advocates here would be happy to talk with you about that. Absolutely, sir. Lisa's probably going to take your name and information.
If I could add one thing, sir, to your question about your daughter. Just one other thing from the VBA side. You mentioned that she was 80%, and you anticipate maybe in the future she's not able to take care of herself. So we do have a special monthly compensation that's a higher level of disability compensation payment that she may be eligible for. There's 2 levels. There's aid in attendance, and there's housebound, which is a little bit lesser level. But so that's something she may need to apply for in the future if she needs assistance, like daily living type things. Okay. Okay.
Yeah.
And right now, that she was going to an assisted living facility, which she couldn't qualify for because she has tremors in the morning, she takes medication, goes down for oxygen. I don't know if you're familiar with that anyway. If she was to go in, her minimal care cost would be $4,500. And so it just wipes her out financially on that regard. So that's why I was leaning more towards a care facility, not a VA that's phenomenal for female veterans. That's how I feel.
Yeah. Well,
Thank you, sir.
Hello. Oh, there we go. Thank you for that question. So we'll have some follow-up with staff. I see a question over here. No, we are first going over here, and then we'll come over there, sir.
Hello. My name is Austin Swiss. I serve in the 82nd Airborne. And I'm just wondering about the chaplain's care for us. I'm Hindu. I'm American.
Yep.
But I see there's no Hindu preachers to help us. I know we live in a Judeo-Christian society, and there's help for Muslims, there's help, but there's no Hindus. I read the Bhagavad Gita, which is the same as the Bible. Somehow or another, we're not recognized.
Well, sir, I can tell you, though, you actually are. Part of that chaplaincy means that we also have the ability to reach out and work with you as Indy. If you would like, we can help you with that information. The chaplain right here will show you and work with you on how to get those services because they are offered here in Orlando.
Well, the books are, but the features aren't.
Well, that is actually where you can work with our chaplain service here, and they will absolutely find a way to make sure that that happens.
Okay. Namaste. Thank you.
Namaste.
Thank you, sir. We got a question over here.
Yes, but before we go on to his question, I just want to make sure that everybody can hear us. So we're asking the panelists and veterans, when you're speaking, please speak louder and clearer, please. Okay?
And I'm Lloyd Brewer. I have a question for Mr. Ellis, but he's already answered that. This question is about the VA Medical Center. Are there any changes coming to the prosthetics department? Because in the past, you can't make an appointment with them. I live in Lakeland, so traveling over here with no appointment, I think it reimburses the travel. And also, there's nobody to answer the phone. So is there any restructuring?
Yes.
Or prosthetics coming?
Well, I will answer the question about the phones first because that's just probably the number one complaint that I think we get at the facility. And I see my good friend Angie here. Angie is our Chief of Health Administration Service. We had just recently, over the last 2 years, been replacing our entire phone system, upgrading all of the pieces, and it wasn't just Lake Nona, it was every single campus, every single outpatient clinic. So it has been a journey. In addition to that, though, we've been working on getting more telephone operators, for one, to make sure that there are people answering the phone. We are still working on that. We're also adding and changed our system slightly to include telephone a queuing system that allow veterans to go directly to the location that they would like to go to talk with whether their specialty or their primary care, or if it's pharmacy or even community care, so that if you have a question specifically for them, that you get directed to that location. And it may not be immediately apparent when we say, well, how does this impact prosthetics? But the goal of answering every phone is my goal. Making sure that our veterans have a conversation with an Orlando staff member to be able to work through whatever their questions may be. Far too many times I've stopped in waiting rooms and spoke with our veterans that say, well, I wouldn't be here, but nobody answered the phone. And so I just drove in and figured it would be much easier for me to talk with somebody if I got here. But at the same time, what you just described, because you didn't have an appointment, would not be something that would be reimbursable for beneficiary travel. So I think the goal is to make sure that we are answering our phone. That's number one. The second part of that is if you're not and haven't started using secure messaging yet, being able to get to your team 24 hours a day, 7 days a week, so that the message goes directly to them. Right now, we're responding within 72 hours on practically about almost 98.5% of all of the messages that come in. Now, that's not high enough for me. I want 99.9%. I'm not spoiled. I just have high expectations like our veterans. I want somebody to answer my question when I have a question. So how are we going to deal with that and solve your prosthetics problem? That's the question, right? We want to know how you can get to your prosthetics team so that they can provide you the answers to the questions that you have. Those are two very important ways that I see to get us much closer to those answers. One second. Let's get you a microphone.
You mentioned secure messaging. That's great, but my providers aren't listed in your application. I had to go through the routine all the specific office to get prosthetics added so I can secure messaging. So I was having options with that.
Excellent.
But they're limited by the way it's structured. So even if you've been there before, you're not necessarily on the
Yeah, thank you. I'm glad you brought that up. That is something that we can definitely work on. And I do appreciate that. I'm an engineer with my background, and I love understanding a little bit more about the system that we have and some of the weaknesses in it. So thank you very much for pointing that out. I think that's something that we could definitely improve. I appreciate it. You want to read another? Why don't we read a question? I see there's, Mr. Lopez, I know there's no doubt we're going to have you ask a question. Does everybody know Mr. Lopez? Mr. Lopez, please raise your hand. Right here. Mr. Lopez has been, how many years now? You got the microphone. How many years you been here with us in the CLC?
3 years and a half.
3.5 years. Thank you very much for your service. I know we talked many, many times about all the things that we can improve upon. But I'm happy to say there's one complaint that I still don't get at the Community Living Center. That is the delicious food that you all receive there. It may not be as salty as everybody wants it. We're working on it, but I know, no, don't give me that. Oh, I know. We have a salt battle regular. So yes, Mr. Lopez, we'll take your question.
Okay, I got 2 questions. It's 2 questions divided one. Number one, from where we get the budget to manage this hospital?
Where do we get the budget from? Congress. So just to give you an idea, what the Orlando VA receives about $2.4 billion a year to staff and care for all of the things that are needed. And that includes prosthetics, that includes community care to the tune of somewhere in the neighborhood of about what? 550, what? $700 million. See, look at that. You guys go up every time I say a number. You practically double it every time. So the reason I point this out is that, I mean, it is one of the largest budgets in the entire VA system. And the roughly 6,000 staff that we have here cover all of Central Florida and all of our community-based outpatient clinics and nursing homes and all of those things.
The other question is since I've been here a long time, I've been seeing that we're short of people.
You say that to me every time.
Yeah.
We're short of what people?
Nurses.
We got all kinds of nurses in the CLC, Mr. Lopez. I know, this is it. You asked me the same question last year at this very same meeting. And I'm telling you, we got more nurses today in the CLC than we've ever had.
I see one nurse get out at 7 o'clock in the morning, and then she has to be back at 7 o'clock at night again.
Yeah, they work 12-hour shifts, 7 to 7.
And then on the weekend, I see too much nurses.
Ah, I see. No, so what is important about your question, Mr. Lopez, and I'm not joking around about this. What we've seen and what I know you've experienced is to make sure that we have enough nursing assistants. We have a lot of, and I say we do have a lot of staffing, making sure that we have the nursing assistants and the LPNs that are there to interact with you regularly and to be part of your life every single day. That is an incredible mission. And making sure that we have the right people is the most important part of that. Not just anyone. We make sure that we hire the best people to make sure that they are there to take care of you.
The nurses that I know, they do an outstanding job. I mean, they go the extra mile. But then, when it comes the next day, I ask her, I mean, are you open? said I used to be off when I have to work.
Yep, that is true. We have nurses like so, and I will give you another example. And I don't want to go too far down the rabbit hole, Mr. Lopez. But what I will say is that we have to make sure that we have staff for all of the veterans that are there. And if we do have people that call out, and there are times when people are on leave or they're on vacation, there are times when our nurses are asked to work overtime, they're asked to cover. We have times where we need one-to-one care, and that is not an everyday occurrence, but it does put an extra layer of need on those nurses. So I would be more than happy to have one of our nursing leaders here. She is able to talk with you a little bit more, but I can assure you, the nurses that are here today are probably thanking you for your statement saying that there are not enough nurses. I think you are part of the nursing lobby that has definitely spoken up. So thank you, Mr. Lopez. There's a second question? I think we have to limit you to one question today, Mr. Lopez. There's no short questions from Mr. Lopez.
This is for the group that the woman to become a president again.
Of the United States?
No, of the CLC.
Oh, okay. All right.
Okay. My question is, where the food come from? Will they be cooking here, or they cook someplace else and they bring it here?
No. It's good. Where's Mary Lou? Mary Lou. So it is cooked on site. That food is here. And in fact, I know many of the questions that we get are about food. We want to be sure that we're providing the best. We also have room service. If you weren't aware of that, you can order directly from the computerized menu on your TV in the morning to determine what it is that you're going to eat for the day. So, and it is cooked here on site. Easy answer to that one.
Mr. Cook, we have several questions from online. Can you read a few of those?
Yeah, sure, Melanie. Go right ahead.
So, the first question, what programs or resources are available to assist small veteran-owned businesses?
Small veterans-owned businesses.
See, I wish I had a whole team of people like he does to, when he gets stumped, he can just, I don't have a list of it, but I know there is a small business, Veteran Business Administration online that will give you more information on that. We do have, I was going to say it's person's online, so I can't even have someone go down the hall and meet with our representatives. I just don't have a lot of information on small business. VBA doesn't really do anything special for that, but.
How can they reach out to you?
They can reach out to me, send me an email, charles.ellis1@va.gov, and I can find out more information.
This is for Ms. Van Heather. What is the portal address for the Veterans Memorial Legacy?
I have it written down over there on the table. How about I go?
We'll get it.
Okay.
We'll get it in the
Okay.
chat.
Thank you.
Is VRE only at the call?
That's an easy one. No, they're not. We have VRNE throughout the state of Florida, St. Pete, Sunrise, Lake Baldwin, Jacksonville. And I'll add one thing. I know Mr. Cook was talking about all the hiring that the VHA has done. VBA has not been able to do so much hiring until recently. And VRNE is hiring. And we're hiring claims processors for VBA as well, too. So if you're interested in joining us, USA Jobs, and over 70% of our employees are veterans, many of them disabled, so keep an eye out for that.
Where are we at with medical marijuana for mental health and pain management?
Where are we? We're stuck to golden. No. So nationally right now, there are several trials that are ongoing that for cannabis and medical marijuana. However, the prescription at this point, as I understand, is not yet available for distribution by VA providers. However, let it be known that the Orlando VA is very much interested in seeing where that process is going to take us. In fact, it doesn't end there. Part of our future partnerships, I see Marisol, right, sitting right down front, is to understand more about what the involvement of psychedelics looks like in the VA and being part of that studies in the near future. I know there's incredible support both at the national and state level for us in Orlando, but really being part of Florida to see what that future relationship is going to look like in therapies that you might determine as non-traditional, but essential, because part of this is like, how does the VA learn about what the future can hold for the different therapies that are now starting to become more common? It does require a lot of advanced work and evidence to make sure that things can go well. We want to do it right and we want to do it safe. So those are the absolutes. But other than that, we've had a lot of discussions about what that is going to look like. In the very minute that we get the opportunity to do so, we will. So I hope that hopefully that answers that question.
Home-based primary care was just mentioned. How does a homebound disabled veteran currently assigned to the Lake Baldwin primary care team get assigned or apply for home-based primary care?
Ooh, that's a great question. Let's see. Where's my subject? Dr. Mongol, right down front, right here. There's a microphone for you. Everybody, please meet Dr. Mamta Mongol. She is our CMO for the Lake Baldwin facility and our acting Deputy Chief of Staff.
Thank you. Thank you, everyone. I wanted to answer that question specifically. So if you have a primary care provider at the VA and you find yourself not able to come in for appointments, the primary care team will put in a consult to the home-based primary care team. And they will then assess your history, your case, and then reach out to you.
Thank you. How long does that normally take, Dr. Mongol?
It would take a few weeks to review your case, but someone will be in touch with you.
Thank you.
What about brand medications becoming more available from pharmacy?
I see Dr. Kill in the crowd. Dr. Kill is our Chief of Pharmacy Services. You know, you're right. It is really nice to have a whole bunch of people in the crowd that know the answers to these questions. I could stumble and fumble all the way through this, but Dr. Kill is our expert.
For those who don't know me, I'm the chief of pharmacy here. We get that question a lot, right? Is why we have brands. And honestly, they're not shown to be any better or superior to the generic products. Also, too, what's important to note is that, you know, when we're treating patients and we're thinking about the hospital medications for the facility, you know, we have 150,000 veterans that are part of our catchment area, and we have to treat those veterans. We have to provide them with medications. So when it comes to why can we get brands, there's no reason, there's no clinical evidence out there that shows that brand is any better. With that in mind, what I think the focus really needs to be on is that we provide evidence-based medicine. You know, when it comes to treating patients with, you know, cancers, when it comes to treating patients with other diseases, we have the capability in VA to provide them with the best medications that are out there. And I think that's really important to look at it that way, is we have to treat all of our veterans. When we provide them with medications that have been shown to be superior, when we have those options available, but when it comes to the specific questions about grants, they're not shown to be any better than generic. Okay, so that's what that part.
Dr. Kill, I have a question for you, a follow-up question. So give an example, if you would. What are the more common requests that we get for brand name medications, and what is the common feeling behind prescribing the generic version? Because it does, when you say the word generic, it sounds inferior in that, but you said that it's evidence-based, so.
I think an example that, you know, can come up is sometimes sometimes patients might have specific pain medications, right? That they want the brands because they feel the brand is actually a better, option for treatment. And, that's not necessarily the case, right? And if somebody's going to use like OxyContin, for example, we have oxycodone as our generic alternative, which just as effective. So, that's something to think about and consider is that, just because the brand is, remember, brand came out first, generics have to show that they're equally as effective, and they do. The FDA would approve the generics if it wasn't equally effective. And so, based on what we see, based on like data that's out there, the generics work for us as well.
Mm-hmm. I will say that one of the more tricky pieces of this, and I'm looking directly at Dr. Barbara Fair, because with community care, oftentimes the providers in the community will say, this is the prescription that I would like you to have. And in fact, because of how the process works, that is not exactly the medication that are going to be provided by the VA. That is one of our more common issues. Wouldn't you say, Dr. Fair? So give it, hang on a second. Give Dr. Fair an opportunity.
So it's really a collaboration with community care staff, my team, and Dr. Hill's staff. But when we send these patients out to the community, what is within the understanding is actually written within the regulations that number one, samples should not be provided by the community providers. We know it is happening. We do see some cases, we escalate these for awareness. That's a common issue. So samples are by names, and then sometimes coming to us, that is not continued because we just heard with the generic. So, and formulary. So the VA formulary has to be followed by community as well. So just because you go to the community, if you do, it still is, as far as medications, your providers are getting this link to the VA formulary, they must follow that to prescribe to you. So those are two items that come to mind.
Thank you, Dr. Fair. Many of my team are not going to want to come back next town hall, I think, but we're gonna work our way through this. Melanie, can we take a card question? Because this is like, I don't want to avoid any of the tougher subjects. We already talked about phones. We've talked a little bit about community care. We've talked about access to some of those places that don't always have easy access, like prosthetics. The next question is one that I think probably hits home for a lot of people, and that's about travel and travel pay. So I know this often comes up. And this one I thought was a good question because it has a little bit of a wiggle through it. And I'm saying this to give Angie Sparks a chance to get ready for the microphone. If Melanie will get ready to give the microphone to Angie for this question. Melanie? That's okay. I know you're busy. So here's the question. Why is it so hard for travel to be processed correctly? This is when you have multiple appointments in one day at different locations. There is always a problem of it not being paid. Can you help us out with that one, Ange?
Specifically speaking, I guess it's probably a little hard to answer, but I can give you a generalized bit of information. So if you have an appointment here in Midtown and you have an appointment maybe a late fall or a little later on the same day, there has to be appointments in the system for us to be able to recognize that. That also goes with community care. So we have to have the ability to see those community care appointments in order for the processing to take place. I don't know how else you want to. I mean, travel is a difficult situation. It's a difficult time for us to go through this. We are working through the backlog. We are working through all of the processes. And, thanks to David and his team for everything that they've done here lately on trying to get caught up, and the National CBT team, which is helping us with that processing for the backlog. But if you have an appointment, there has to be an appointment in the system for us to be able to process that claim.
Can you tell me how many claims we have to process per month?
Per month? What we have to process?
How many should we be processing a month? What's our total that we receive?
200 a day, I'm pretty sure is like about average, I think, across the campus. So
About 4,000 a month.
4,000 to 5,000 a month, yeah. And it's on any given day too, so we could possibly get up to 250 to 300 on a day, maybe 100 on another day. So that's probably about average.
So if we had to make a recommendation for some that are struggling with the claims being processed, would you say that it would be better to file a paper claim or a claim using the, so the beneficiary travel claim system? So how many of you have used beneficiary travel claim system? Are you finding it to be useful? Is it no money? Yes, that's sort of a half and half, I hope. But, and I know, how many of you still only use paper claims exclusively? I see one hand, thank you. There's a brave soul for raising his hand. And, oh, we got another paper claimer? We want to be sure, yeah, let's work with you on trying to find a way. It is far easier because right now, the same clerk that helps file those claims is the same clerk that now has to process the paper claim and the electronic claim. There is no automatic payment. It has to be put in, scanned in, and then processed. So the easier way and the time-saving way is for that same person to only have to touch it one time. So if we could ask for your help in that, that would be one way for us to be able to get it.
I would like to add to that just a little bit is that we also have something called PCI or patient check-in. So when you arrive for your appointment and you check into that appointment, you automatically get notified that you're asked, do you want to submit to the telephone? If you guys remember the kiosks years ago that we used to use, it was kind of the same thing where you walk through, you checked in, it asked you if you wanted to process your claim. We have the same thing with the patient check-in app, which is used through Veterans. So we have that option available too. So there are several options available. We do have clerks that will help you with setting up your accounts or teach you how to walk through the program and then just set it up for you on your phone. We will do everything that we can do to make it easier on you.
Outstanding. Thank you, Ange. I'll see if Cindy would. Okay. Everybody okay? Uh-oh. Hey, so Cindy, do you have a card?
I do. And the question is, what must we do to ensure that all funeral costs are paid before need? Again, the benefit at the National Cemetery Administration is for cemetery benefits. So if you want to do anything prior to that for your funeral home needs, that is a personal choice. That's your personal decision. I personally suggest that you go find somebody and shop around because right now is the time to find the best deal. Believe it or not, it's just like car shopping. You want a good deal, you shop around. Find somebody that you know is reputable, that a family or friend has worked with, and what their expenses were. And that is the best way, seriously, to be able to find out what is the best way for you to have the most economical services provided to you. Again, you pay for all funeral home expenses. Once you get to the cemetery, that is when your benefit kicks in, and no cost once you get to the cemetery. I do also want to say that the site for the Veterans Legacy Memorial is va.gov/remember, which I obviously couldn't. So.
Well, thank you for that. We're getting close to the end of today's meeting. So yes.
I'll just,
Yeah.
real quick, on that follow-up. So there are additional monies available for veterans if they're service-connected and they pass away. Things like $2,000 is the burial benefit. Also, if you pass away at a VA facility, your transportation costs are covered. And there's also a non-service connected death burial benefit, which I believe is a little over $1,000. And that just requires that you be service connected at the time of death. So just add that to it. Melanie, one thing too, you asked me about the Small Business Administration. So I looked up using my team, Google, and SBA.gov, smallbusinessadministration.gov administers that, and they have resources for veterans on there. It's not something administered by the Department of Veterans Affairs, but there are resources there. I had one one question too on a card that I'll just go ahead and address real quick, because probably a lot of people want to know is why are claims taking so long to process? And I gave a bunch of numbers before about how things have gotten better, and things have gotten better, and the average claim now is 70 days. Years ago, we're talking 2-3 years. Yeah, it was really a long time. There are still cases, though, that require more than 70 days. That's the average. It depends on the complexity of the claim and the type of claim. So, for example, if it's like a radiation claim, those are very specialized claims, and they're a centralized process at our Jackson Regional Office. If they're a Camp Lejeune claim, those are very specialized, and they're worked at the Louisville Regional Office. Military sexual traumas are now specialized, and they're worked at a certain regional office. So we don't work everything as things have gotten more complex, there's been more specialization, but those types of special claims typically take longer.
Awesome. Thanks for that. So we got time for just a couple more questions. Looks like we got in the back, and then some other hands up too.
I have a question for you about starting to reach out to communities that are outside of Orange County. Specifically, Polk County is the largest growing demographic area in the entire country. And the Villages is the largest retirement community and is growing farther than any other retirement community in the country. Is there any thing in the strategic planning of this medical center to start to reach out and service those veterans in those areas more effectively?
You fit right into my plan for world domination. Because both of those facilities and counties that you mentioned, one of them is Tampa and the other one is Gainesville, North Florida. So the Villages is Gainesville, Lake City, and Polk County, Lakeland and Tampa. But that doesn't mean that veterans don't come this way. So we do find that a lot of the veterans that are there, we are and have been working on the expansion in Lake County. So right now we have Tavares, which is a relatively modest size. I'm not going to say small, but it's a modest size community-based outpatient clinic. I'm trying to be positive. You got to work with me here. It's moderately sized, CBOC. But we do have a plan, and so part of that is hopefully going to be, and I say hopefully because we put forth so many of our future master plans. What is Lake County going to look like? And I think it is going to be one of the fastest growing areas, and still continues to be, because that corridor is just blossoming, right? The whole Turnpike corridor is on fire with veterans moving to our area. So we're looking to have a multi-specialty clinic in that space. But in the meantime, the Villages, the outpatient clinic, because it's a lot larger than a CBOC, is also growing. They're going to probably build roughly 250,000 square foot multi-specialty clinic in the Villages and somewhere in that region. They haven't awarded that yet. They don't know what the site's going to look like, but it's inevitable. You cannot have Florida and the number of veterans that are moving here and not find a place to care for them. It's just incredible growth. Wow,
right,
now the
we
hands
got
are coming
over
up all over the place. I will try to be brief in any of my answers, and I know my colleagues here will try
I
to
got
help
the
me with
camera
that.
behind me. He told me to sit down, so
I
I want to
didn't do
make
it.
sure I'm
I didn't tell
okay.
you.
Could you mention to everyone in the group and also online about your volunteer service? I'm one of the outreach ministers, so I know about your volunteer service. Could you tell everybody about your volunteer service?
What a day to pick today to talk about our volunteers, because we just had an incredible annual ceremony where many of our volunteers that received the number of hours, thousands and thousands of hours that have been donated to the service of our veterans. And I say that very specifically because there's not a single person that volunteers that doesn't go direct, where the time and effort doesn't go directly to serving veterans. And it's not just Orlando, it's all over. But what I'm very, very proud of, and in their quest also for domination, they have decided to change their name to CDCE, which nobody quite understands entirely, but we lovingly call them voluntary service. They just are, they will always be voluntary service to us, because that's what it means. But they are part of civic engagement. They are part of reaching out and seeing all of the volunteer organizations that are here today and making those strong connections. So we are growing leaps and bounds. One of the strongest partnerships that we're now finding is in suicide prevention. So many groups. Thank you. Thank you to everybody that's really involved in that. It's a massive effort. There's absolutely no way that one group, and not even a group as large as the VA alone, can handle that. We all have to find a way to play a part. And all of those volunteers and contributing all make a difference. So thank you very much. It was great. You're like Mr.
I just
Lopez,
want to remind you
standing
that
up
you
for
can
everybody.
also volunteer at the National Cemetery, okay?
Awesome, thanks. We have over here.
Yes, for the panelists on the end, it's about the burn pits. When we first come home, a lot of times, I'm sure some of the older veterans know, they'll tell you that there was no such a thing as what you're claiming. And then 20, 30 years later, they find that there was something. And then we're asked to go back in time and prove that what happened to us actually happened. But then we're met with all kinds of red tape. Even if our unit was specifically identified as a unit that had exposure, why is it so difficult to get through the process of proving a claim, especially for burn pits specifically?
Thank you for your question and your service. That is a good question. And burn pits, it's one of those things that once there's a burn pit registry, and now folks are automatically adopted into that, so you don't have to register. You should be already registered automatically. But once you're on that registry, you obviously still have to file a claim. And once you file a claim, if the claim is a presumptive type of claim, so like PACT Act, for example, a lot of all these cancers now are presumptive. Once an issue is presumptive, the burden of proof is lowered tremendously. So all you have to do is prove that you have an honorable discharge and you have that condition, and then it's just the level of disability. If something is not presumptive, meaning it's not one of those automatic presumptive issues, then that's a little more hard. They have to, do a little more development, try to get medical opinions, try to link one act and service to another. It gets kind of complicated. I would encourage you, if you want to check on your own claim, to speak to one of our representatives here today. They can be very complicated. That's what I was talking about. Some of the more complicated claims are the non-presumptive claims. For example, a slam dunk claim now is if you're a Vietnam veteran and you have diabetes. That's all we have to do is show you're a veteran, you have diabetes, and what's your current level of disability, and you're service connected. But if you have a special condition and you think it was because you were exposed to some type of toxin and that is not a presumptive yet, then it's a little more of a hurdle to link those two things together with your service, if that helps.
All right, thank you. We got one over here and then a microphone over here in the front, if you can.
Yeah, hi. I had been reading some information on the internet about the VA possibly overhauling their dental program, to maybe expanding it, expanding it for those of us who are not quite at 100%. I was just wondering if there was any truth to that.
I see Dr. Faruqi in the crowd. So another one of my good friends. For as much as we have, and are we the first or second largest dental service in the entire country?
For serving veterans, we're number two.
Number two
right
in the entire country. And I think one of the more fascinating statistics that I found is that all along I-4, there's something about like the tooth. I call it a root canal, actually, all the way from Daytona Beach all the way to Tampa. There is so many. It's like a hotspot for all of that care. And I think we provide a lot of that, wouldn't you say?
Oh yeah, absolutely. So historically, we are one of the largest dental services in the country, but we are also the fastest growing veteran population. So we grow about 10% every year. Now, yes, that is an ongoing challenge. We have our veterans that are eligible, but for the ones that are not, we get that question all the time. So a lot of veterans are not aware of the VA dental insurance program. So we do try to explain that does offer some services. So there is some, I think, MetLife and Delta. So definitely anyone that comes to our service we try to rule out emergencies, see what we could provide, but if someone is not eligible, we try to give them options potentially that what could help. Yep.
Awesome, thanks. You don't think, are there any changes to the eligibility requirements for dental that you're aware of?
No, not for dental. I mean, if you're 100% a permanent total, you have dental care. Other than that, you have to be service connected for some type of dental trauma in service, and that particular disability will be treated, but not the entire dental treatment thing. So that hasn't changed.
Oh, thank you.
All right, thank you. We got a question up front.
Hi, everyone. My name is Marisol Salgado Garcia. I'm retired major and new to Florida. I know, Tim, I want to give a recognition and just to thank you as a veteran, new to the area, but as a veteran overall. For those that don't know, some of you guys, I gave you the Florida for Ibogaine handout. And on this past weekend, the DAV, Disabled American Veterans, held a pretty huge convention at the Shingle Creek Hotel. It's a mouthful. And we were able to bring Brian Hubbard, who is the CEO of Americans for Ibogaine, and who has been a huge part of President Trump signing the executive order for psychedelic assisted therapies. I've been working behind the scenes with Mr. Cook and Dr. Adam Golden at the SimVet Clinic because they are working on a psychedelic wing as well. So me poking at the subject a lot, and the fact that Brian Hubbard was here, we capitalized on that, and we coordinated his visit to the SimVet Clinic. So I want to say thank you so much as a veteran for opening the door for that, because one of the things I'm reading back there says, I'm not invisible. And that opportunity alone spoke dividends to me as probably one of the younger generation veterans, but for the future as well, as I'm advocating for psychedelic assisted therapies, which helps, I know they're gone, with dementia, Parkinson's, Alzheimer's, and the studies of what's going on with these medicines have only scratched the surface. And I'm very much looking forward to continue those conversations. And thank you for giving me the seat at the table for that. So thank you again on that. And then I don't know how you guys made it happen, but you brought the senior advisor to VHA to come down here and also be part of that conversation, which is huge. So again, thank you so much for you and your team for that. And then
Everybody loves Orlando.
Yeah, yeah. I was reading the stats,
the way
and
it is.
1.9 million veterans here. So it's huge. Your voice matters. Share that there's town halls so that other people can come to these, whether online or in person, so that they can hear our grievances. And with that being said, I know that SecDev signed, Secretary of War, the mandate for testosterone testing for active duty. What is being done for the veteran community for, like, you have to specifically ask when you come to your primary care, it's like, hey, I want to get looked at my hormone, testosterone, progesterone levels. Is that going to become part of our yearly testing? And how do we get, on hormone replacement, testosterone replacement, stuff like that in the years to come?
I'm gonna hand that one off to my good friend and colleague, Dr. Mongol, if you have a response to the testosterone and progesterone testing that might be part of the current, or what is the current situation and what is the future for that?
So I was just discussing that here. We have not heard of that yet in our clinics. That's not to say that it's not coming. And if it is something that is advantageous to our patients, we're more than happy to do it. But currently, it's just on a need basis. If we find that they have the symptoms that warrant the testing, we're happy to do it.
Yeah. We just had a presentation yesterday, I believe, from the chief of endocrinology. And there is a fair amount of testing that is already taking place, but it is much like what Dr. Mongo was saying. It has to be driven by the conversation that takes place right now with the primary care team, if that helps.
Yeah, because people don't understand like how much it impacts mental health, gut health,
Right.
and everything else. So like even just the conversation, it's I think put on the naturopathy side of the spectrum. So I don't know if at any point, like maybe just adding it as part of the questionnaire, because a lot of people, especially older generation, don't know that, let's look at your testosterone levels for men, which are at an all-time low nationwide. So prompting that question in their assessment to begin with, because again, they don't know what they don't know that might be able to help them.
Thank you. Thank you very much.
All right. You want to do one more? All right. One last question.
There's always room for one more.
Thank you very much. I work with homeless veterans and homeless veteran reintegration program, and do a lot of prison ministry and whatnot, helping veterans transition out of homelessness. And work with a lot of veterans that are either coming from that situation or exiting the domiciliary and either waiting for HUD-VASH or trying to get into an SSVF, but a lot of these facilities are at capacity. So coming down the pipe in the next 2 to 5 years, has there been any talk about housing resources, and then what are we going to do for our homeless veteran community?
Yes, a great question. So to take part of that and to also maybe ask Dr. Kara Boyer, our Associate Chief of Mental Health, to maybe help us a little bit out with the domiciliary question and the transition between residential rehabilitation into to supportive housing. I think those are two very, very important things. I will say that we've already started the exploration of what it is going to look like to have more constructed housing in and around the hot spots. And Orange County clearly is a hot spot for homelessness. I've done a number of point-in-time surveys myself, gone out and actively encountered and worked with homeless veterans that really are just trying to find the right connection, the right door to open at the right time. And often if it doesn't happen at that very moment, it is the beginning of the fall. So one of the best things that our veterans have the opportunity to do is to reach out to us. Being a homeless veteran right now really offers you an extensive amount of services, including, if I'm not mistaken, part of our residential rehabilitation program is dental services. Isn't that correct, Dr. Faruqi? See, look at that. We're putting all these bits and pieces together. Look at the whole team. Amazing.
So yes, thank you. And I so would like to meet you afterwards just for a few minutes. I appreciate that. So I am Kara Boyer. I'm the Associate Chief of Staff for Mental Health. And we do,
You got to get closer to the microphone.
I'm an old dom chief. I usually don't need a microphone. So we have 116-bed domiciliary, and the majority of our veterans are coming to us homeless or unhoused. We have a 20-bed domiciliary care for homeless veterans program as well within the DOM. And with that, we are trying to purposely find veterans who want to go back to work. And so they're going to stay with us longer. We're going to help find them employment. We're going to get them the skills that they need in order to have that gainful employment. And those are beds that we've really protected over the years. You can be homeless or unhoused in any of the other bed services as well. With the DOM, we partner very closely with HUD-VASH. So our goal is to have the veteran with some version of a stable housing plan before discharge. Does that always happen? No, but it is our goal. Especially if the veteran is willing to work with us and explore options that maybe aren't their favorite either, because the resources are very limited in this area. We have a crisis in the Orange County, Osceola areas. So once they've left our HUD-VASH team, they are amazing. We partner very closely with them, and they will continue to follow the veteran. That's intensive case management with those patients.
Thank you.
Of course.
Does that help? Okay.
Oh, yay! Here's a real resource.
Look at this. Come on down.
I was like, where are my social
We
workers?
got more resources. Hang on one second. Now that they have a chance to speak, you will be able to find them anywhere.
Hi, everyone. I'm Rachel Flamio. I'm the acting chief for
Hold the microphone
social
up.
work.
Thank you.
I'm going to pass the mic, though, to Lisa Goodwin. She is from our HUD-VASH.
Hi, my name is Lisa Goodwin. I'm one of the homeless program supervisors over at Lake Baldwin. You and I have met before. You came and presented to our staff. The HUD-VASH program continues to grow. We actually received more vouchers this year, so that's very exciting, and we will be housing additional homeless veterans. But anytime that anybody has any questions about homelessness or needs resources, your social worker on your primary care team is going to be your best resource. We do have emergency housing, we have transitional housing, and then we have permanent and supportive housing available.
Excellent. And we have a mobile clinic. It's a small RV that has exam space in it, which currently is operated out of the Lake Baldwin campus and goes out, I believe, twice a week to different areas throughout all of our communities. So all 6 counties it is serviced by. And wherever there is a need, we want to be there. And I do have one final amendment to that comment, because in addition to the homeless services, I think one of the best things that I've seen and run into is the Veterans Justice Outreach, and being able to work with the court system in the different counties. I know Brevard County is a huge supporter. We've hosted them and trying to find ways to make sure that there's an easy on-ramp from the court system to the residential rehabilitation, so that it's not expected to go out and then figure it out on your own. That there's a really wide open door for you to enter into a place that is ready to take you for your rehab. And I couldn't be any prouder than that team, so certainly. Let's see. Are we about ready to wrap up,
I
Kendra?
think so. So let's give a round of applause for our panelists, subject matter experts, and all of you who asked questions. So thank you very much. So just want to say thank you very much for all your feedback and comments today. If you have more questions, you can always fill out one of these cards. You can reach out to patient advocates or your primary care team. And just want to say your feedback was important to us. We'll be following up as appropriate. And just want to say thank you very much for being here today. Thank you for your service for the veterans and for the family members and everyone who supports. So thank you and have a great day.
Great job, Kendra. Well done.